Archives of Prasar Bharati presents the timeless treasure of golden era.
A happy, well-adjusted child is a source of immense joy to those around him or her. On the other hand, a cranky, irritable child makes one wonder what has gone wrong with this child. What is the problem? The fact is that children, like adults, do suffer from stresses and emotional problems, leaving scars on their impressionable mind, resulting in behavior disorders.
A child who is quarrelsome, hostile, irritable or aggressive may only be reacting to the immediate events that take place around him or her, which is soon forgotten. When these moods persist to develop into sustained emotional reactions such as fear, anxiety or depression, they may be just a reflection of deeper psychological problems that interfere with normal functioning and the healthy adjustment process, requiring the immediate intervention of a mental health professional.
The stresses in a child's life can come from a number of sources. These stresses could be from within the family, such as the death of a loved one, marital discord between the parents, sibling rivalries, parental neglect, or even poverty or broken homes. These stresses could also arise out of the school or the school curriculum. These could be also contributed by the child's own personality, which could help him to cope or lead to emotional breakdowns such as anxiety, depression, phobias, or psychosomatic illnesses.
Children are faced with many kinds of stresses. Some of these are ongoing in the form of events and situations that occur in the family. Some of them may be acute, such as the death of somebody close in the family, or an acute breakup in family structure, or some acute problem in school, because different children respond to the same trauma by different kinds of reactions.
In general practice, the kind of common emotional problems which we see in children and adolescents include anxiety very often, depression. Some children become withdrawn, they stop relating to other people. Some children become defiant, some become hostile or aggressive, and parents find a difficulty in handling with them.
Some children present with just sleep and appetite disturbances. Some children present just with academic backwardness. Some children present with serious feeding problems. Others present with withdrawal, and yet others present with acting out behaviors in the form of aggression and so on.
The manifestations of emotional problems are different depending upon the age of the child. Generally below 5 years, the child manifests more of anxiety symptoms. The child has fear of school, or fear of strangers, or fear of animals, and fear of separation from mother, or fear of being left out by parents when the child goes to school. However, above the age of 5 years, the child manifests more of withdrawal and more of irritability and anger and adjustment problems.
Anxiety, which is a common manifestation, it is not manifested as a anxiety as it happens in adults. But children become anxious, they become nervous, they become fearful, some of them become phobic.
Common phobias seen in children are basically the child feels very scared to come out in the dark or especially in the night. And especially the phobias is about the specific object like dog, snake, which is also seen in adults also. Other phobias may be he has got a problem to stand up in the class or to utter any answer though he knows the subject, so we will put it as a phobia only.
Even school phobia, that is the child becomes scared to go to the school, is a common problem.
The school phobia is commonly seen before the particular type of a 2.5 years or so, and in that basically the school phobia develops if psychologically the child is not prepared to go to the school.
When I go to school, I start vomiting. I have problems while breathing also.
Even on days when she goes to school, she will go to the clinic. She keeps complaining of a stomachache and a vomiting sensation. Either it's because of some test or she's just pretending. Since it's an everyday affair, we feel she's just making it up or pretending.
Children with school phobia, at times we have to even find out whether there is a problem in the milieu in which the child, school milieu, whether there is a threatening teacher, whether there is a problem with the siblings, whether there is something which threatens the child in the school and the child is fearful. In some other children, this phobia could be a reflection of the problem which may be going on at home.
मैंने फ़ोन किया था तो चड्ढा ने मुझे बताया कि साहब 9 बजे निकल चुके हैं। अब बताओ 9 से 11 तक तुम कहाँ रहे?
सारे काम ऑफिस में थोड़ा होते हैं, कुछ काम बाहर भी होते हैं।
डिनर का टाइम भी 9 से 10 हो सकता है। उसके बाद चले जाते, अगले दिन चले जाते, क्या हो जाता?
Children who are depressed may not manifest depression in the terms as adults express their depression. Their expression may be in terms of temper tantrums, crying. Though it is seen that children do express even suicidal ideas, ideas of hopelessness, ideas that they do not want to live at home, the more common things are withdrawn behavior and showing a kind of disinterest in his play activities, in his studies, sometimes even don't take interest in eating. These kind of things can be seen.
I don't like anything. I keep thinking about my past mistakes and feel quite guilty about them. I don't feel like doing anything at all.
If we say anything to him, he becomes all the more sad and complains of a headache. He keeps saying that we should not say anything to him and allow him to be.
Children with emotional problems need not always come with unhappiness, depression or fears. Most often we come across children who manifest with headaches, chest pains, abdominal colics just before going to school or before exams or before they attend a function.
Commonly seen psychosomatic problems are abdominal pain, headache, breathing problems, breathlessness, or even getting fits and paresis, and even at times the children feel that they are not able to see the things. So pains and aches of any type, chest pain or even pain in legs, are commonly seen problems.
In such cases, the simplest thing would be that when a pediatrician notes the child has a physical problem which is not really looking like a total physical problem, they need to go into details about the child's immediate life events or the child's immediate family environment, and also look at the child's educational pattern and also the problems at school.
In all these conditions, it's important that a medical examination should be done and the physical cause of these problems should be ruled out. And once it is known that it is psychological, then a detailed psychological evaluation into what are the causes for these problems is important, because symptomatic treatment is not enough.
At times, emotional disturbances in children may actually be manifested in the form of eating or sleeping disorders, but these on deeper probing may reveal hidden fears, apprehensions and conflicts which are related to the parents, siblings or even problems in the school.
Eating disorders in children could manifest themselves in the form of refusing to eat food at all, eating excessively, longing for one particular kind of food or diet, or at times even a strange, persistent desire to eat inedible substances like chalk, mud, wood or paper known as pica. Sleep disturbances in the form of disruption of sleep, nightmares, talking in sleep, sleepwalking are also signs of an emotional disorder in a child.
Emotional reactions to situations or conflicts can also be manifested in the form of strange behaviors or habits. These can cause a good deal of embarrassment to to the concerned child as well as the parents. Enuresis or bedwetting or encoparesis, that is soiling the clothes with feces, are the more serious of these habit disorders.
Bedwetting is a very common child psychiatric problem. We see it very commonly in our clinics. Most clinics in India have found that nearly 8 to 10% of children seen in such clinics have presented with bedwetting, or it's present along with other emotional or behavioral disturbances.
There are two kinds of bedwettings which we divide it as, that is primary and secondary. Primary bedwetting is in which a child has never learnt proper toilet training, that is he continues to pass urine in bed.
Usually we say that up to 5 years of age, we would not consider any episodes of bedwetting as abnormal. About over 98% of children tend to have obtained bladder control by the age of 5 years. But if bedwetting persists beyond this age, it is taken as what we call nocturnal enuresis, a behavioral problem which needs remediation.
Secondary bedwetting is one in which he has learned to control his urine problems, but he is, after say 5 years or 6 years, he suddenly starts wetting his bed at night. Secondary bedwetting, whenever you go into the details of the history, you find that there has always been either there has been a death in the family or some separation, or there has been a birth of some sibling.
Children with this problem are also accumulating a lot of other difficulties. They may be the butt of ridicule by family members. They may be facing problems from schoolmates who come to know about the child having this problem. In fact, some children may even have it during daytime. And also, they tend to start restricting themselves from, say, going into some public functions or going and staying overnight with friends or relatives. And gradually, they may start getting known as people who don't mix.
We started getting worried because he would often wet his bed or pass motion and not be even aware of it. It's not a major problem if we are at home, but it's difficult if we have to stay at somebody else's place. Initially, we would feel extremely embarrassed and scold him. People would often make fun of us, saying that we have not been able to guide our child properly. They never realized that he had a genuine problem.
Tips for parents of children with bedwetting. Do not make the child feel guilty or ashamed. Do not discuss the problem in front of others. Do not scold or punish the child for wetting the bed. Do not allow the child to take fluids after 7 p.m. Remind the child to visit the toilet before going to bed. Reward your child for every dry day.
A few other habit disorders which can be quite embarrassing to the child. These are hair pulling, thumb sucking, nail biting, fidgety behavior or nervous tics. Actually, whenever there is any kind of an emotional distress or extreme stress, the child learns unhealthy ways of coping with them. These can then become firmly entrenched as habit patterns.
Thumb sucking is considered a physiological response which actually occurs in early period of the life, but later on it becomes a habit because generally when the child has nothing else to do, he is getting bored, so he would get into thumb sucking or nail biting. Another thing is whenever the child has certain stress or anxiety, at that time also with these certain mannerisms they feel relieved of their anxiety. So many children use this thumb sucking and nail biting while they are studying, or they have some difficult situation, they have been scolded, or they do not like certain type of things. But if the parents are able to understand why the child is doing, and the way of checking him is not in a way of showing an anxious reaction to the child, then it can be helpful. It's also important for parents to understand the cause and then accordingly keep the child busy, or to teach the child how to cope up with stress or anxiety in a more effective manner.
Whatever the type of developmental disorders, they are usually associated with behavioral or emotional problems like withdrawal, disobedience, difficulties in communication, or hyperactivity.
Attention deficit disorder, also known as hyperkinetic syndrome, are the names given to a particular kind of developmental disorder which has a certain constellation of signs and symptoms. Now, the kinds of signs and symptoms that can occur in a hyperkinetic disorder is hyperactivity, decreased attention span, and high distractibility.
Attention deficit disorder is a syndrome in the childhood, mainly presented with inability to focus their attention in particular thing for a longer time or for a time generally it is required.
In this condition, the child is unable to hold its attention for even a brief period of time, such as 1 or 2 minutes. It becomes very impulsive and it demands gratification of its wants immediately. It is difficult to manage these children and they become disruptive in school as well as at home.
Dalpat's family finds it extremely difficult to cope with his attention deficit hyperactivity disorder.
At the age of 6 months itself, he was quite a restless child. He would throw things or break them. By about 1 year, he used to run around and had become all the more destructive. He would throw away anything that he could get hold of. He is very short-tempered and hits out at other children. If somebody teases him, he starts banging his head and often hurts himself.
मेरा जो बच्चा है वो 5 साल का है और उसका हाइपर एक्टिविटी इतना ज़्यादा था, अभी भी है, कि इसको बीटिंग एटीट्यूड इन.
My son is around 5 years and suffers from hyperactivity. He is quite violent and destructive at times. He beats up and hits out at anything and everything. Even we are not spared. He kicks us, pulls our hair, and at times it becomes difficult to control him.
In order to make a diagnosis of hyperkinetic syndrome or attention deficit hyperactivity disorder, you need to have the child show the same symptoms in different situations.
We cannot go anywhere because of him. Even when somebody comes over to our place, it's difficult to attend to them because of his restless behavior.
Medications are almost always used in significant disorders. Psychosocial methods of management are ways in which the family and the school are taught to handle this child. We find that medication just helps 50% of the problem. Bulk of the problems at home and at school with medications should be managed with psychosocial methods of management.
Doctors have advised us to learn special training skills, which would be very helpful for controlling his problem. I don't want him to remain like this and become a burden on others. He should become self-reliant and be a useful member of the society.
That he can be recognized of his own.
Behavioral techniques refer to reinforcing or helping the child to have good behavior, appropriate behavior, and weeding out inappropriate behavior. These techniques use reinforcement such as material rewards like a toffee or dolls or toys, or verbal reinforcement such as praise in order to inculcate appropriate behavior in the child.
In this fashion, it should be possible to handle the child in a manner that makes the child feel that even small amounts of improvement are taken note of.
An important area of childhood disorders are those which are related to the conduct and socially acceptable behaviors. These can start in very early childhood also, such as headbanging, temper tantrums, rebelliousness, and negativism. These behaviors could be the forerunners of more serious problems later on in life, which could involve acts of aggression and violence towards people and property.
The child is extremely hostile, aggressive, breaks things, and it is a reaction of the underlying psychological conflict which the child has. This has to be managed properly, otherwise at a later stage it might affect the total personality growth of this individual, and the child may have a tendency to go into a psychopathic or sociopathic personality type of disorder where things become very difficult to handle at a later stage.
Children who are difficult to manage at home, who have temper tantrums, who have aggressive outbursts, or this kind of behaviors can also be managed in the home setting better than in a hospital setting. We recommend to parents is that they ignore the child for that period of time, and the idea is that if you keep ignoring the child, whenever the child performs this behavior, slowly that behavior will definitely diminish and stop.
Most of children's problems can be effectively managed with psychotherapy and counseling only. Medication is to be used judiciously, and that also only in severe emotional disturbances or psychosis. Sometimes in severely disturbed children, a brief period of hospitalization may be required to remove them from a stressful situation or to manage acute symptoms of distress.
Here are do's and don'ts for parents. Be authoritative, not authoritarian. Love your child unconditionally. Allow your child to express feelings freely. Spend time listening to your child's problems. Guide and supervise your child's activities. Reward your child for good behavior. Don't dismiss your child's problems lightly. Don't scold or punish your child for his inabilities. Don't discuss your child's problems in front of others. Don't transfer your anxieties onto your children. Don't give double messages. Don't hesitate to seek professional help if required.
Children are not immune to the stresses that beset us in life. Be sensitive to your child's need and be constantly there to support him through the ups or downs of life, instilling confidence. Mostly, children's problems can be helped through parental guidance and support, but if not, seek professional help. In the end, it is gratifying for all concerned, the child, parents, and the professional, to see the child back on the road to normalcy.
Silent in your tears, wasted in your years. When you cry alone. Recourse to fantasy, living with insanity. Another night beside the phone. The war within, addictions in the bin. Curl up with your memories, togetherness and harmony. Watch your mind, heal the pain, seek your meaning by